Hello, my dear students and my dear friends and dear nursing aspirants. Welcome you all to your channel Nursing Concepts by Raghav. See, in the today's video, I'm going to discuss one of the important scale, or we can say the scoring system that we commonly used in the ICU setup. See, when the patient gets admitted to the hospital because of his critical illness or the critical condition, so the patient needs a continuous assessment and monitoring and the evaluation of his condition. Okay, so we need to assess on the daily basis or on the regular basis related to the patient condition, whether the patient's condition is improving or whether it is deteriorating. All these need to be evaluated. So there were so many scoring or the scaling system that we commonly used in the ICU. Say for an example, like OSF, that is organ system failure. Okay, then SOFA score, then mods, then even the simplified acute physiological score. So like this, there were so many scores are there that we routinely we use. And uh, RSS scale is there, that is Ramsay Sedation Scale. Then RASS scale is there, agitation and the sedation scale. So many of the scales we use to assess and evaluate the patient's condition, as well as we will use to use these scores to assess on a regular basis, especially when the patient is on the like mechanical ventilator. Okay, is on the mechanical ventilator support, where patient requires a regular assessment and the evaluation. So among these scores, today in the video we will discuss one of the important score, that is RASS. Okay, so we will discuss in detail about the RASS, how it is to be assessed, and what is the interpretation of the score or the scale, and where we use it and how do we use it. So that all things we will discuss in the today's session. चलिए शुरू करते हैं आज के टॉपिक, दैट इज RASS. तो अगर आप पहली बार वीडियो देख रहे हो तो वीडियो को चैनल को सब्सक्राइब करना मत भूलना एंड वीडियो को एंड तक जरूर देखें. तो चलिए शुरू करते हैं आज के टॉपिक. Okay, RASS. See, RASS is nothing but a Richmond Agitation-Sedation Scale. See, the name itself indicates, see, this has been developed by the Richmond Agitation and the Sedation Scale. See, here in this condition or in this scale, we are going to assess the patient's agitation level and the sedation level. By giving some score, we identify whether the patient is awake, alert, or whether the patient is unresponsive or under very deep sedation, or else even we identify the patient agitation level, whether patient is agitated or restless. So all these things we are going to assess in this scale, that is what the RASS, that is Richmond Agitation Sedation Scale. So we use this especially in the patient who are critically ill and admitted in the ICU. Okay, so this is an ICU scale that we commonly use to assess the agitation and the sedation level in the critical ill patient, especially who are on the mechanical ventilator, and even those who are receiving the or on the sedative treatment. So for them we use this scale. So the what is this scale? So this is used to assess used to assess agitation and sedation in critically ill patients in the ICU setup, in the ICU. Okay, especially on mechanical ventilator, and for the patients who are receiving the sedatives, or the patients who are receiving sedations. The sedations can be used not only for the ventilator cases, even the sedations can be used in some procedures. Okay, so in that condition also we need to assess the sedation level of a patient. So there you can use this scale. See, what is the use of this? Okay, it will use this, or why do we use this scale? See, this scale will help you to adjust the sedative medication. See, so that the patient should not receive an overdoses of the medication, or patient should not be over sedated or under sedated. So the actual requirement of the sedative medications can be decided based on the this scale. So this will, first thing is, it will help to adjust the sedative medication sedative medication. And second thing is, this will help to monitor the patient level, monitor a patient level of sedation and the agitation. Okay, and it will prevent the over or under sedation. Under sedation, see, means what the actual requirement of the patients based on the patient's condition, or the level of consciousness, or we can say, or level of sedation or the agitation. So we can decide the how much the medication is required for the patient, whether we need to again sedate the patient, or we need to reduce the sedation medication. So that all things can be assessed, that will be helped by this scale. Okay, so now we will see, and one more thing is, see here, the score is, what is the score we give here? The scoring system, or the score varies between -4 to +5. Okay, so overall it is a 10-point scale. It is a 10-point scale. 10-point scale. Okay, means -4. See, the minus indicates the positive score. Positive score indicates the agitation levels, whereas negative score indicates the sedation level. So if the score is 0, means not the plus, not the negative, so this indicates the normal status, or we can say the patient is alert and calm. So not being agitated or not being sedated. So the patient is absolutely normal, the patient is very alert and is very calm, and we cannot see any anxiousness or the aggressive behavior, or maybe any restless behavior cannot be seen. So that is what the 0 score. Okay, so this is a scoring system. So now let's see how this scoring system will be done in the RASS. So here we can see this scale or this chart. See here, I have told you the scale will be from the +4 to the -5. See, the first plus or the positive score indicates the agitation level, whereas negative score indicates the sedation level. So 0 here in between is the alert and the calm. It is a normal. Say +4 is given when, and what we call them with the +4 based on their behavior. So the agitation will be assessed just by observation. Okay, so to assess the agitation level in the patient, we do just observation of the patient, whereas to assess the sedation level, we give some commands. Okay, here the patient will be given with some voice commands, and some physical stimulation will be given to the patient to assess the sedative level. Okay, so let's see how the agitation will be assessed. So the score 4 will be given when the patient is very violent and very danger to the staff. Means the patient is very violating behavior, and uh, he looks quite danger to the healthcare worker or to the staff. Then he is labeled as a combative. So where the score is given a plus a 4, and the +3 is given where the patient is very agitated. So that means the patient starts pulling his tubes. Okay, then catheters, all these things when he does, then he is called as a very agitative patient, where the score is given +3. And +2 is given where the patient is called as agitative behavior. So that means where the patient is agitated but not fully, means here it will make some non-purposeful movements. Okay, he will make hand movements. Okay, frequently he will does this, and sometimes he fights with the ventilator. So this is called as a agitative behavior. Okay, so then plus one is called as a restless behavior, where the patient is not aggressive but is very anxious. So that is what we call it as a restless. So it doesn't make any movements, but patient looks anxious, that is emotionally disturbed. So then is called as a restless behavior. So there it is given a score of plus one. And if the score is given for a patient who is calm and alert, means is absolutely fine. So mean is paying attention to the whatever the patient or the healthcare provider is there. So he listens to the commands, he pays attention whatever the healthcare or the staff says to the patient. Then this is all been observed under the agitation level. So the next comes is the negative score, that is sedation level. So minus one score will be given for a patient who is very drowsy. So drowsy means here the patient is awake but not fully alert. See, he can uh, maintain the eye contact with the staff. Okay, for your voice. See, when you call by his name, so he can look at you. He can maintain the eye contact, and he can open his eyes, and eye contact can be maintained more than 10 seconds. Then it is a drowsy. We call it as. Okay, the patient can be waken up by your voice command. Okay, here we give the voice. So in the picture we can see here, so this is a touch, this is a voice. Okay, with the voice we assess this sedation level. So if the patient is waken up or maintain the eye contacts to your voice for more than 10 seconds, then we call it as a drowsy. The score is -1, and -2 is for the light sedation we call, where the patient can maintain eye contact to your voice but less than 10 seconds. So briefly awaken or wakes up and gives and or maintains a eye contact. Then -3 is a moderate sedation we call, where the patient is just opening the eyes, or he will makes the eyes but there is no any eye contact so to your voice, then it is a score of -3. So these three parameters are, or these three levels are being assessed by giving the voice command, whereas the next other two, -4, that is deep sedation, where the patient doesn't make any response to your voice but he can make a response or he can open his eyes for the physical stimulation, or for the physical stimulation. There it is given a score of -4. Then -5, where the patient is unarousable or no any response to your voice as well as for the physical stimulation. So there it is called as a unarousable state, or the level -5. So this is been assessed by giving the physical touch. Okay, so this is how do we assess the RASS scale, agitation and the sedation level. So then what is the interpretation? Okay, now you have assessed the score of agitation and the sedation level in a patient. So how do you interpret this score? What is the target of RASS scale in the ICU patients? So we can say that is a target RASS scale, RASS in the ICU patients in ICU. So what we can maintain? See here, if the patient is on mechanical ventilator, if the patient is on mechanical ventilator, so your ideal RASS score should be in between -2 to -3. See, -2 to -3 means, so it should have at least open his eyes to your voice, or at least to the physical contact, that is to your voice, or at least you will maintain the eye contact. So that is what your target of RASS scale in the ICU patient, that is on the mechanical ventilator. And if the patient is on the procedure or procedural sedation means, for because of the some procedures, if the patient is receiving the sedations, then your ideal, this is an ideal score. Okay, ideal RASS score should be -3 to -4. So it should be there. Then if you are doing a monitoring neurological monitoring So your score, RASS score should be between 0 to -1. Okay, so this is what the ideal target for the RASS in the ICU of patients. So this is all about the RASS. And there is and one more scale, we call it as a Ramsay Sedation Scale. The Ramsay Sedation Scale, so this is also an, the name itself indicates the sedation scale. So means in this scale or the scoring system, we do just assess the sedation levels, not the agitation level. So this is a very simplified manner. uh, Level of consciousness, so you can say, or the patient who are receiving the sedation, we will assess the level of a sedation. So that is what the in this condition means, you can say whether the patient is awake, or whether the patient is sleepy or drowsy or unarousable state. So that all things we will assess in this Ramsay sedation scale. It is called as RSS. So RSS means not the what the uh, Rashtriya Swayamsevak Sangha. Okay, so this is Ramsay sedation scale. The Ramsay sedation scale, as I told, this is used to assess the depth of depth, or we can say the level of sedation in ICU patients, receiving the receiving sedation. Okay, so the patients who are on sedation, we can use this scale to assess their level of sedation or depth of sedation. So here it is a 6-point scale. It is a 6-point scale. Score ranges from 1 to 6. Okay, so see here what we do here is they will give some commands. Okay, means the stimulus will be there to the patient, to the stimulus how the patient gives the response. So based on that only they will assess the level of sedation. So what response or what the stimulus they will give? The stimulus here they will do is they will use is the voice command. Okay, or else any physical stimuli, or globular tap. Globular tap means they will do the tapping over here. So this is a globular area. So or else they will give a voice command. So to that stimuli how the patient gives a response, based on that they will assess the level of, that is again this is being assessed by voice command and the physical touch. See here the scoring system. So the level 1 where the patient is very anxious, hesitated, and or restless. So the patient, when the patient is anxious, hesitated behavior, means the patient is wake up or awake. So then this condition score we give as a 1, or we can call it as a level 1 sedation. So then level 2 where the patient is cooperative, oriented, and tranquil. So then level 3 where the patient responds to the commands only. So means the patient, when only for the commands he responds, then it is called as level 3 or level 3 sedation. Okay, then level 4 brisk patient response to the light globular tap or auditory stimulus. Say when the voice command is given, or when you make a very light tapping over the globular area, so if the patient gets awake, then it is called as a level 4, then, or a score of 4. Then score of 5 very sluggish response to the globular tap or auditory stimulus, means the response is reduced or sluggish, then it is called as a level 5 or the score of 6. Then level 6 there is no any response to the globular tap and even for the auditory stimuli, means the patient will not give any response to the voice command and even for the globular tap, that is a physical touch. So this is in this all the below 3 states, so these are called as a sleep level. So these are called as a awake levels. Okay, so in this all these conditions the patient is sleeping, means the patient with the stimulus is arousing. So here, the without the stimulus, the patient is awake. So that is what the difference between the first three and the last 3 points. So now this RSS, that is Ramsay Sedation Scale, has been modified, or there are some changes has been made in this. So they now we are using the modified Ramsay Sedation Scale. Okay, so now it has been changed, that we call it as a Ramsay Sedation Scale modified. In short, we can say MSS, modified sedation scale, we can say, or modified Ramsay sedation scale. So in this we have a level 8, whereas in the earlier or the previous Ramsay sedation scale we have 6 levels, but here we have 8 levels. So that is what the difference. The level 1 is, sorry, so the level 1 is where the patient is awake, anxious, or the restless, and in the level 2 where the patient is cooperative and the tranquil, and in the level 3 is awake but responds to the verbal commands only, and level 4 is where we can have a brisk response to the loud auditory stimulus or the glabellar, and the level 5 where again the patient is asleep, sluggish response to the loud auditory stimulus or the glabellar tap, and the 6 is where we can see the sluggish or no response to the painful stimuli, that is level 6. See here, these two are been added. Okay, level 7 where the patient is asleep, where the reflex withdrawal is for the painful stimuli. So when you do the painful stimuli, the patient withdraws the hand, or withdrawal reflex can be seen. In the level 8 where the patient is having no response to any of the stimuli or any of the external stimuli, including the pain, voice, or whatever the stimuli you give, the patient doesn't make any response. See, in this modified, we there are two these levels, uh, 6 and 7, 2 points are been added. Okay, so that is sluggish response to the pain and withdrawal reflex is been added in the modified scale. So we can precisely make an identification or score the patient based on the level. So this is what the sedation scale. So hope the today's both the scales are very clear. One is a RASS, that is Richmond's Agitation and the Sedation Scale, and another is a Ramsay Sedation Scale. Both are being used for the assessing and evaluating the sedation levels in the patients who are on specially receiving the sedation or on the mechanical ventilator. तो अगर आपको वीडियो अच्छे लगे तो ज़रूर लाइक करना, एंड प्लीज़ प्रेस द like button, and please share it to your friends, those who are preparing for the competitive exams, and keep watching, keep supporting, and please subscribe and support, uh, and we'll see you with an again a very amazing topic in the next video. But till then, keep learning. Thank you.